It's really such an honor to stand here and be with you in Kochi, and I'm really so grateful to be here. I'm so happy that I get to meet people for the first time that I've been talking to for a very long time. There are some people from Africa who I'm meeting here in India, even though we've worked together. But I really am excited to be in a space like this because rooms like this hold a lot of promise. It's a space where people are really open to learning, they're open to new ideas, they're open to new ways of thinking, and that is a really amazing space to be in. And for you as policymakers, evidence synthesizers, healthcare workers, you hold global health in your hands, whether you believe that or not, but you have a part to play in how we do, how we use, how we share evidence. And you dedicate your lives to being these translators, to the sense makers. And evidence synthesis experts do something that is quite rare. They take scattered truths that lay in all these little papers and spaces, and they put it all together, and like magic, poof, they've got conclusions that they can share and say, this is what we know about this topic, which is wonderful, because you literally help the world decide what to do with what we know. So today, I'm going to talk about 4 things and take you on a little journey. We're going to begin by talking about the imagination. Then we're going to move into diversity. We'll take a moment to honor the invisible labor that comes with engaged research. And then we'll speak about a concept I've been working on with another colleague of mine at Stellenbosch University called field building and research equity. But before we begin, I don't have any conflicts of interest, and so let's march right on. So let's start our travels, and I'm going to start with a very simple idea, which is evidence is not the end of research, it's the beginning of the imagination. Because when we treat evidence as the final stage, like you've made it to the end of the game, you're really not opening yourself up to the possibilities of what evidence can do. Because when we use evidence with our imagination, we open up space for discovery, for doing things that bring justice, that bring change and transformation. And it can really spark some real change in global health. And if you think about the world that we're living in, the context that we are in right now, there's a polycrisis that is happening everywhere. Healthcare systems are under strain everywhere. Communities are navigating complex challenges, social, emotional, environmental. There are so many things that people are going through. And as the generations come, the next generations deal with additional crises. We didn't deal with the digital crises growing up. I know I look really young, but don't let it fool you. We didn't deal with the digital crisis. But my kids are dealing with the digital crisis, isolation, loneliness, depression. The world is changing, constantly evolving. So how we do research, how we generate evidence, how we share evidence, the context around that is all going to change, constantly changes. Usually in global health, we start with problems. We think about disease burdens, risk factors, indicators. But before that, somebody used their imagination. Somebody saw some patterns. Somebody saw a gap, and they thought to themselves, I wonder what would happen if. Or they thought to themselves, I wonder if there's a relationship between. I wonder if this affects that. I wonder what the place of this variable is in this whole equation. I wonder what people on the other side of the world think about what we're doing here. But somebody thought about a new idea. And as we have the agency to think about these new ideas, are we letting others also have the same agency to offer their new ideas? Or do we work in silos that only our imagination counts, only our questions count? Usually we treat imagination as something separate from the evidence, but what it does do, it reveals the blind spots, things that our traditional methods probably cannot see. It helps us ask better questions, newer questions, and people are like, what in the world are you doing? Last year, I launched this project on astronomy and mental health, and people are like, why? You're in public health, like, you've got mental health interventions. Why not investigate? Why not see what is there? It allows us to have depth in our interpretation, because then we start asking more than just the basic questions. And it also opens up the space for new and diverse ways of knowing. Which brings us to the second point, which is around diversity. Diversity in evidence is necessary for holistic understanding. And I'm using diversity very loosely. It could be diversity in inclusion of population groups, diversity in settings, diversity in methodologies, diversities in ways of interpreting, diversity in dissemination. But diversity is essential. If we look at how we define global health, we see it as a collective effort to understand around the lived realities of implementation of evidence. So global health is not just about clinical problems, it's also about how people live, the resources they have, what burdens they carry, what futures they imagine for themselves. Because you can have any illness and receive any treatment and receive care to the highest level. But if you don't believe you're going to be well, your mental health can suffer and decline and you will remain ill. Health is not just what your body does, it's everything around you. And I think Promise mentioned this embodied experience. And so when we think about global health, like, what are we reimagining? So I started looking at old papers, and what these papers show is that people were studying clinical outcomes, and then all of a sudden there was like a huge media fair, because they're like, oh, it's not just clinical things, it's also how people feel. It's also the structural outcomes. And so this is I would say, an old study from, I just missed the year now, but I think it was in the early 2000s. And they were talking about the discrimination and how that affects people's high blood pressure in America. And they were so shocked that discrimination could affect high blood pressure. There was a study around diaphragms for African women for prevention of HIV, because there was this thinking that if you wore a diaphragm, you couldn't get HIV. They're like, oh no, shocking, women don't want to use this, but also it doesn't work. Then there is a paper that speaks about community health workers, and they were shocked. The tensions that community health workers experience to implement programs. Why? Because they don't have the power in their setting to run a program. In theory, it seems nice. In the RCT, it works well. But in the local clinic, the nurse doesn't have the power and the agency to run that program. So there are multiple examples of how what we've generated doesn't live in the real world. And I made a little note here just wrote it down in case I forget, is that maybe we need to move from the gold standard of evidence to evidence for life or evidence for impact. And maybe that's the new gold standard.
What can the images do?
So I quickly wanted to share with you an example of a QES that we did a few years ago and how we took that QES into the real world. And I've broken it up into these 5 steps. So this QES was about why young women adhere to the antiretroviral treatment. So I'm going to take us through the little story that I've tried to make here. At first, we identified the need to write the story. And prior to that, Am I missing a slide? I probably am. Yeah, prior to that, we did some systematic reviews. We did another mega aggregation, and we came up with all these reasons why young women do or don't adhere to their medication. Because I am a visual person, sorry, my slides are just like a bit jumbled up. I use storyboarding to make sense of the data because I wanted to create the evidence in a way that I could give it to the young person to check with them, is what we found in the evidence true for you in this community? And giving them a 30-page review was not going to work. So I started drawing the story, the collages, these images. There's a whole paper around the methodology of that, but that's not for now. And we created this collage that told the story. From that collage, we then went into, sorry, I'm just going to flip through quickly. We went into the field. This is a sample of what our original drawings looked like. This is an example of me taking like 48 papers and drawing out, and I'm not the best artist, just trying to take the review into the real world. Drawing out these things, and then I digitally recreated the story into the storyboard that you had first seen. How I wrote up the review was storytelling. So there aren't the normal results about paper 1 said this and paper 2 said this. I found my storylines, and using the quotes from the paper, I created these little prototype stories that explained each storyline. So that when a young person read this, it was as if they read in a storybook. Like, these are the main findings. It's in the first person on purpose so that it's more relatable. And it has an accompanying picture. Eventually, I regenerated that drawing into a digital storyboard, which we then printed. All these words that you see there are quotes from the included papers. We removed all the quotes until there were just pictures left. And about a year into our primary study, we took this picture into the field. So we had lots of interviews, lots of video recording, lots of photographs that we were taking. The young people were working with us. They were generating most of the content by themselves. These are collections of things that they found in the clinic that held meaning for them as women living with HIV. And then we went on this camp. This is at the end of our entire study, so it's after 2 years now. And this is the first time they saw the picture. So they've been telling their story for 2 years. We took these things, we gave them a bunch of sticky notes, and all I told them to do is look at the picture and see which of these images resonate with you and your story. Which parts of your story do you want to tell the world? And which parts of these do we want to put into our report that we're going to share in the documentary? And so everyone made their notes. They circled what was important. We went back and we recorded some more footage. One day. And the story. For me, that was an exciting moment because I had never presented a review to a community member and have them dance in reaction to systematic review. But there was something really profound that happened in that moment. Because what it showed me is that it is possible to take your review evidence into the world and to see how people make sense of it for themselves. Because there were some review findings that didn't apply to them in my context, in their particular community. And then there were some things that they noted that wasn't in the review findings. For example, one of the girls, and this is like a year into the study, she came to this realization by herself. She couldn't understand why she hates a tablet so much. She's adherent, she takes it religiously. She has been taking it since she was 6 years old. She realized afterwards when she looked at the photos and the video, it was the color that bothered her. It was blue. She wanted it to be white, like Panado, like a normal tablet. But the color, it irritated her so much. But that's not in the systematic review. There was another one that was speaking about the traditional medicine that she takes that cleanses her. It makes her feel good. And she couldn't understand like why the nurses are telling her, don't do that with your medication. And then when she started looking at the ingredients, because so they were allowed to use the laptop in the office and they could go on the internet, she started looking at what's in the medication and how it works, and she's been engaging with us for all this time. She realized, oh, this is why. But no one's ever explained it to her. It was always just, don't do this. So interpreting those findings are really important. We've then used those same findings for a documentary. You can see the storyboard is a tablecloth in an exhibition. We put the objects on there. People could engage with the review. They could engage with it in a very different way. The third thing I want to talk about, which is so important to mention, is the invisible labor of engaged research that must be made visible in primary research, in systematic reviews. There are lots of things that happen in engaged research when you do other ways of generating knowledge, other ways of doing research that people don't talk about. Being a participant in a study, particularly ones with vulnerable groups, particularly ones that are attached to stigma, is an emotional labor. It's an emotional roller coaster for the researcher and the participants. There's a lot of emotional work that goes into that. From neighbors coming to knock on your door, why were they here? What are you doing? Can you give them my phone number also? To hiding why you're involved in some study. To navigating the clinic so that nobody knows you have HIV, but you're part of the HIV study. To having hope because this person is giving you attention and then they're going to go away. I had one girl throw over her artwork at the end of the exhibition and go throw it in the bin because she was so angry because the study's over, because the exhibition was the end. And she's like, now Lynn is going to forget about us. And I said, don't worry, that's not how it works here. And I think yesterday I spoke about somebody that as much time as you invest in building these relationships, you actually need to spend the same amount of time breaking up with people. If you spend 2 years getting to know a community, you need 2 years to break up with a community and move out of the community slowly. And I don't think we think about that, but even when we write about that and what we report from primary studies, we don't include that in our work. We don't include that in our assessments of the primary research. There was a really nice paper written, it's just come out, by somebody at UCT from the Knowledge Translation Lab around this invisible labor, which leads me to my very last point around field building, research equity for transformation. Because when you think about the invisible labor, then you really start thinking about how do I build in the field and how do I practice research equity in a way that leaves people better off than when I found them, and how do I generate evidence for impact instead of just evidence for the sake of saying this is what we know about a certain topic. So some of you know I've been a patient for a very long time. I think since birth I've just been a patient and in and out of the hospital system long before I became a researcher. But that patient experience has taught me something that you really can't learn anywhere else. And even now, like even to this very day, when I am in the bed, the hospital bed, or I'm a patient, the only thing I wish the doctor would ask me is, am I okay? Not how is my pain? And it's a very different question. Because recently I was in hospital, and I was there for an extended time. My daughter couldn't visit. I was missing her, and I really wanted to see her, but I couldn't. And the doctor's like, oh no, you'll just stay another 2 days. For him, I'm just the patient. And in his opinion, it's best for me to be there. But he's not asking me, why am I so upset? He's just asking me, how is my pain? And I kept thinking back to, you know, when we are working with people, we're so hyper-focused on that thing we want to investigate that we forget that it's just a small portion of who they are and that they are whole people. And so how do you invite and welcome that whole person into your work? When you are synthesizing the primary studies, are you looking at the deeper layers inside the primary research to understand who these participants were? Are we holding the primary researchers accountable for how they report on the participants in their papers? Are they bringing the whole person and presenting the whole person? So I'm really passionate about health and research equity. It really is the foundation of good science. Field building, I'm starting to understand, is a really slow craft. It's when you're trying to create something new, new conditions, new ways of understanding. It's not something you can do overnight. It takes time. There's a lot of people who are involved in building the field. And research equity is really a big part of that, because it asks whose voice is included, how is the world, and whose world is reflected in these findings. How do we confront structural patterns? How do we keep communities outside of the margins and inside where we are? So when we think about using this field building and research equity to transform global health, we do think about it as a political movement, because it's about holding funders accountable for the type of research that they are putting calls out for. It's about applying and pushing back when they say, oh, but we don't want this. You say, but why not? Because this is important. It's relational. It's about building with people and connecting and understanding the emotional and invisible labor. It needs lots of infrastructure, so we need to change it in all these little spaces. It's not enough to change the primary study. You also need to change the evidence synthesis and how it's done and conducted. It involves a lot of boundary work and boundary making. And it does take a commitment to the future. So in closing, I would like to issue us all with a call to action, to allow our imagination to shape our questions, to guide our interpretations, to build evidence ecosystems that welcome the full range of the human, and then to recognize the unseen labor that communities carry in every study, and lastly, to have the courage to build new fields and embrace research equity. So the takeaway for today, field building gives equity a structure, equity gives field building a purpose, but with the imagination, they will transform global health. Thank you.
Now, just checking, do we have Promise online as well? All right, while we get that tech sorted and everyone starts asking their questions, I'm going to kick off. So Lynn and also Promise, both of you highlighted the importance of imagination, lived experience and context-sensitive evidence in shaping more equitable health systems and research processes. So, there's some very big ideas, I think, in this field as it relates to equity and research and evidence-informed decision-making. And what is missing for a lot of people is how to practically do that. So maybe it would be great if everybody could reflect on how can we practically embed community voices into evidence-informed decision-making, but also into research in a way that is systematic and ethical and sustainable. Lynn, would you like to go first?
Hello. Okay. Thank you for that. So one of the ways we have done that now is that we have community advocates who work with our research group on a full-time basis to help us be accountable from the inside out, firstly. And also, we're not trying to turn the community advocates into researchers. We expect them to be exactly who they are and to advocate for the community in how we do what we do. But I think it's about also using every opportunity to talk and network. The same energy that you put into networking with other collaborators is the same energy you should put into community members, because they have a lot of trust issues when it comes to research and researchers and science. And so you need to spend a lot of time learning. We met with the SAN Council of South Africa, I think, a few months ago, and the same thing was said. They said a lot of researchers come to the SAN Council and they want to do research on our people, but nobody asks, can we visit and learn from what we are doing? And so I think that for me was a really important lesson, is that sometimes you need to spend time learning even when you're not doing research, and getting to know people outside of your research projects, so that when you do have those research projects, you have already built your relationships and your networks.
Wonderful. Now, I've just seen that Promise has joined us online. Welcome, Promise. It's so great to see you. Thank you so much for sending your presentation through. We all really enjoyed it and are reflecting on it now. So welcome. Now, I might get you to follow up from Lynn, if that's okay. And just in case you didn't catch the question, it was how can we practically embed community voices into EIDM and into research in a way that is systematic, ethical and sustainable?
Thank you, Bianca, and thank you, everyone. Apologies again that I couldn't make it in person. I think it's really a great question, but, I think Prof Lynn's response was quite comprehensive, but maybe just to kind of like add from my end, yes, I think we recognize the importance of, involving citizens in such initiatives, where the role of community leaders, community health workers that also Lynn mentioned, it's important that we incorporate them into such activities, be it research, be it EIDM. But I think overall, if we think about the diversity that exists in some contexts, it's important. I think it even boils down to simple things like translations. How do we translate our EIDM products, our research products into several different languages so that they can appeal to different types of people. So I think that's just to add one element in which we can systematically, ethically, and have sustainable ways in which we can embed community voices into evidence-informed decision-making, in my sense. Thank you, and over.
Thank you so much, Promise. Vanitha and then Bhumika, do you want to reflect on your context?
Yeah. So in India, we have a very diverse community. We have a lot of languages. So when we try to pool evidence or synthesize evidence, it's very difficult for it to be applied to everyone. So what we can see is a positive shift that is happening in how evidence is viewed. So we are now looking more into qualitative systematic reviews, mixed method reviews, and that has a little bit of contextualization that is happening. And that has been helping us. So I'm very happy to say the shift is being observed and being validated by the policymakers. The Indian Council of Medical Research, they are looking into mixed method reviews, qualitative reviews. So earlier it was just pool prevalence or something like that, which really, it's so different. Each country, each state is so different, cannot be applied. So there is a positive thing that is happening, and diversity is definitely getting that attention. Yeah.
Thank you, Bianca, for that question. So I would like to talk about stakeholder engagement. So I feel this is the most important aspect of the overall review process. So who are your stakeholders for that particular review? So are you involving the community that we drive that evidence to in your stakeholder panel is an important question. And again, the second aspect is on the knowledge translation. So we're emphasizing on knowledge translation. When you think about knowledge translation, we think about to who, when, and how, and why. So these questions will help us answer certain questions like who do we involve and how do we disseminate these findings, whether they're capacitated enough to understand what the evidence says. And the third aspect I would go along with Vanitha, that is emphasizing on mixed methods and qualitative reviews. So we have mixed method synthesis where we talk about qual, quant, and qual, or call it quant and qual. But then why not qualitative, then systematic reviews, and again qualitative? So the qualitative to redefine our research questions to conduct systematic reviews, and once we conduct the systematic reviews and what are the contextual factors that we need to consider, can again take qualitative synthesis aspect where we understand the perspectives from the community, such as gatekeepers and who are actually working at the field level. So I would like to give an example. So currently we are working on a review where it talks about land rights of women. So when we looked at the literature, we hardly had any literature that was actually helping us define our systematic review questions. And when we thought about who are the subject experts for this review, then all we could think about the community or the women who are in the particular village or in the rural sector. So and this is how the various aspects of involving the community as stakeholders in the process of conducting a systematic review plays an important role. Thank you.
Thank you.
Thank you, Bianca. Promise, your comment on when the floor is falling, gold standard evidence can be unusable has resonated with me and also with a lot of members in our community today. So can you clearly outline, it's very difficult to act on the best evidence we have, as we all find out, but fixing the system is beyond the scope of researchers or universities. What can be done to address this?
Thank you so much. I think it's a brilliant question and very relevant, and I'm actually glad that that aspect resonated with a lot of people. Yeah, and I think the departure point becomes essentially that it almost becomes an issue where this whole idea, these whole issues that we face are beyond the scope of researchers. But I think as a starting point, really, it's let's keep talking about these issues and highlighting these issues, so that the momentum around them does not die. And I think I might have also pointed that out in the presentation itself, that we are researchers. We focus on EIDM activities. We do systematic reviews and all of that. But I think it's also important that we drive EIDM, we drive the importance of these evidence-based decision-making products. Perhaps it might be, we focus on doing research and systematic reviews around that particular topic area, where how can we sustain evidence-based healthcare for impact in those low resource contexts, and to ensure that there's a kind of like a equitable access to healthcare. So the first point is really about let's keep talking about the topic, and drive the provision of these resources so that they're readily available, in as much as we drive EIDM. So that's where you see the importance of complementary systematic review and primary research or primary project implementation at that stage. And there's several aspects that are also connected to that use of data sets. I know that there are some organizations that are making efforts, towards this, like I think an organization called CDD in Ghana. One thing that they are basically doing is, they're working with constituency, creating what are called constituency profiles. Essentially, this is gathering data sets around constituencies to kind of like highlight exactly what the issues are around, not only in health but in education. And these are the data sets that are actually used by parliamentarians to highlight the issues that are on the ground. Thank you, and over.
Thank you very much, Promise, for that response. I'll start with Bhumika. Can you, I'm sure these issues, structural issues, are common outside of, in all other different countries too. Can you enlighten us on how India has done in addressing some of these issues?
Yeah. So this is a major challenge that we are facing, and what the solution, what I think of and what we have already implemented is sort of use of evidence program. So use of evidence program for the stakeholders, and it's something also called as mentoring program, where we actually mentor the stakeholders and the one who actually uses or influence the policy makers on how to exactly use the evidence by capacitating them, so by involving them in the review. So one such program that we conducted on emergency preparedness for public health emergencies. So we call it as mentoring program, where the officials from CDC India and NI, National Institute for Disaster Management, and stakeholders working at ministry were involved in the overall mentoring program. So where they were trying to understand what is that when we talk about evidence, and how can they actually make an influence. So this led to a dissemination program with the government officials. So this is the first breakthrough where we were unable to actually tell the government or tell the policy makers, and we were struggling to actually build a relationship with them. So this program actually kind of helped us build a relationship and understanding the gap in decision making. Thank you.
Thank you. Do you have anything to add to that? Benita?
Yeah. So something that I've noticed over time is that we frame questions most of the time. The researchers frame the questions. Actually, for it to work, it should come from the community. So there is a shift that is happening. There is importance being given to implementation research, in which you don't start with a question. Okay, you go there and find out what is the need, and that is guiding the research question. So that is always going to be more effective. So I think contextualization, implementation research, all this is going to solve few of our problems.
Thank you. Lynn, would you like to add? I know you said you started in saying how you involved the community. So would you like to add more to what he does?
I actually want to add to what Promise was saying around the question around, I think it was if the floors are falling. The falls are falling. And I thought, when you bake a cake, you can bake that cake and you can put it in your fridge. Tomorrow you can bake another one and you can put it in your fridge. And you can keep baking hundreds of them and keep them in your fridge and no one will ever see it. But you could look at it with satisfaction. Look at all these cakes I made. They're so beautiful. Or you could send them to the bakery. And everyone could look at those cakes and they could say, these are all the different types of cakes and this is all the evidence that we have and this is what we can select from. Or you can target somebody and send them a slice of your cake and say, this one is for you. This one is going to change your life. So as much as the scope of researchers is not to be the government official, the politician, to change the road, to change the construction, you do have a responsibility to share what you have found. And I think that is part of the scope of the research that you are doing and your role as a researcher. It's not to shove your cakes into your fridge. And it's part of it is to share with other people what you know, but part of it is also to target and to say, this slice is for you. And you need to do something about it and hand over the responsibility to that individual or stakeholder or person.
Thank you. Thank you very much, Lynn.
I just want to pick up on that before we go to the next question, because this is my area of passion in terms of communicating, disseminating research. Now, you showed us some really creative ways, Lynn, on how you do that. I would love to hear from Promise and Vinitha and Bhumika, what are your experiences in, it doesn't have to be, no, we're not all artists or storytellers, or I'm definitely not going to sing and dance. But what are some of the ways that you have approached sharing and disseminating research to try and involve and get it to the people that matter, targeting, that person or that community or that decision maker with that piece of cake? What are some of the ways that you've done that?
I can add to that. So what we are doing now is making something like a plain language summary, so everybody can understand what the research means, and sharing it with not just policymakers as such, but to the community as well. So a lot of media we can use to our advantage. So we do a lot of social media posts and a lot of press releases regarding that. So everybody understands what is happening, what are the results. So that is one thing that we do here.
Yeah, thank you for this question, Bianca. This is very important, and we are working on evidence translation. So it's evidence synthesis is of no use unless it is translated. And how we translate the evidence to different population is also very important. So at Campbell South Asia, we have come up with various evidence products that where we have translated evidence synthesis to different knowledge translation products. So one such product is called as Evidence Q&A. So where in consultation with stakeholders and the community leaders, so we've come up with important questions. So this topic is on gender, climate and agriculture. So we came up with a series of important questions and we categorized them under different important themes. And then for each of those important questions, so we synthesized long summaries, short summaries, and also policy briefs, so which could be directly adopted by even the researcher or the community people, or it could be policy makers, that whatever the information that they need, they could directly access on those important questions. So this is one of these portals is already live, and the other portal that we developed is on evidence and gap maps, which I'll be talking about in my presentation today in the afternoon. And So here, so we have this evidence and gap maps where we actually identify the gaps, and as well as we actually tell us what studies are available. But we went ahead on synthesizing the effect size and summaries for each of this intervention and outcomes. So for the particular intervention and outcome, what exactly that evidence talks about. It's not just what evidence is available, but what evidence says, which is directly accessible again to the policymakers. And we are trying different ways to translate this evidence. Again, the policy briefs, plain language summaries, and the dissemination. So we are not doing storytelling as of now, but I was really impressed about the storytelling aspect of the presentation made by Professor Lynn. Thank you.
Thank you both. Promise, would you like to share some of your experiences?
Thank you, Bianca. Yeah, no, certainly. I might not be able to share, the practical strategies that we've adopted, but just to highlight some developments that I've seen and what others have also tried. I think one of the aspects, and to think, to avoid repetition in some sense, this whole idea in the South African context around engaged research has really gained serious prominence up to a point, and I think Prof Lynn would also know this, that the Human Research Science Council and the National Research Foundation in South Africa, they're continuously holding a whole conference around engaged research on its own, right? And, engaged research takes many different forms, including participatory research and all of those different elements. So, even before the dissemination that we are talking about, just doing the research itself, engaged research has become, a very, very, very big topic. And those are some of the elements that, at Elevate Evidence Hub, we're trying to kind of like implement in future when we do our primary research. So that becomes a very a serious element to incorporate. And I think we also need to think about, okay, how can we adopt the principles of engaged research above and beyond from project implementation in evidence synthesis itself. So I think that's a key point to recognize as well. And then secondly, again, I think this idea of storytelling, I know that it has been mentioned quite a bit, but organizations like eBase have taken storytelling to the next level in terms of communicating EIDM, right? And it's really, really, really important to recognize some of these, practical steps that are important, because in our context, those strategies are extremely, extremely, extremely important. I know that they might not really be applicable in other contexts, but for most African countries where there's a serious limitation in terms of literacy, for instance, it becomes important to adopt such strategies. Thank you, and over.
Thank you, Promise. Now there is a question for Lynn that has lots of votes. So I better get to that one and not just go on my own agenda. So thank you, Lynn. Amazing work and ideas. Did you face any challenges in getting your non-traditional qualitative evidence synthesis published?
So this is an easy answer. No. I was very surprised because I was expecting lots of pushback when I submitted it, but it was published in 2 weeks. Wow. Like the reviewers answered almost immediately. There were very minimal changes. People were just really excited to see something new and something different. If you look at the paper, the images are not as nice as the ones I showed you. They are very hand-drawn in my garage during COVID. But I was very surprised. But I think people appreciated the reason it was done the way it was, and they saw the value in how it could be used. So no, I got more pushback from the co-authors than the reviewers. Because they were like, you can't submit this. And I'm like, yes, we can.
Thank you for that, Lynn. I think this question's back again to you, Lynn. Could you explain more about decolonization of evidence in relation to knowledge as public property?
Yes, I think this was also something Promise spoke about, so I'll answer briefly to give him a chance, if that's okay. Because, I mean, when you do engaged research, you don't own the knowledge that you are making. It does belong to everybody, depending on what the context and the content is. Like in my study, you know, the girls didn't want to be identified, so we had to use other names, but then there are other instances where they use their real names. So they choose when and when they don't do it. But it belongs to them as well, and so every time I present their work, their pictures, I ask their permission. Because you wouldn't like, you know, to see yourself dancing on the international stage. You want to know where's your pictures been shared. So I do think that that is important, and that, you know, you give credit where credit is due. But I'll leave the rest for Promise.
Yeah, thanks, Promise. Could you expand a bit more on decolonization of evidence in relation to knowledge as public property?
Yeah. Thank you so much. Yeah, I think firstly it comes back to this idea of, you know, obviously engaging citizens and all of that, but maybe an extra layer to add, and perhaps it comes back to this idea of, you know, the eco-convenient truth. You know, us as researchers and academics who have had an opportunity, you know, to, you know, say, for the lack of better word, have had the opportunity to engage in high level of education. There's a certain perception and obviously a certain level of acceptance with which we do when it comes to, you know, these concepts of EIDM, the methods that, you know, in all honesty have been developed in the global north. And, you know, from a practical point of view, so essentially, you know, once you have that certain level of education and acceptance, there's a lot of things that are quite logical, right? But then again, you know, when you look at issues on the ground, it becomes, you have this experience and sense where there are certain individuals, certain parties, certain departments that are not quite receptive to concepts. They'll call them basically foreign concepts. And it again ties to this whole idea as to who is going to drive this EIDM within those contexts. That's really, really important. And it's important. One important element is to incorporate the role and recognize the role of local players in driving, you know, EIDM, because, I mean, ultimately what we want to achieve is to get policymakers to use that evidence. But the whole idea is who is going to drive you know, that EIDM context. And in as much as, you know, these ideas almost become foreign, when you work with local players, there is certain ways in which you want to communicate to, you know, policymakers. And I think also I've highlighted this important element that a simple, you know, just a simple use of a word like accountability on its own can have negative connotations and implications in terms of, you know, how that idea is basically accepted. So we need to be sensitive to context in that sense, and that kind of like helps in this whole idea of decolonizing. So that's one aspect that I can basically mention, that, you know, recognize the importance of local players, local individuals, to have that balance. Thank you, and over.
Thank you, Promise. Now, as we come to the end of the panel, I'm an optimist, so I always like to talk about hope at the end. And in this, you know, in this discussion, there are a lot of barriers and challenges and power dynamics, and we've heard a lot about that this morning, but also in conversations yesterday in plenary one. So my final question to the panel is, reflecting on all of this and working, you know, in this space, you need to be an optimistic person, otherwise you just give up. So what gives you a sense of hope in terms of what you are seeing that is changing or promising as it relates to working more equitably, working closer with communities? What brings you hope?
Can I start? I think what brings me hope is seeing people being more open to engaging in research equity. because I think there is an appetite for it and it is growing, and more people are invested in using new methods. Even if you're just starting out, the fact that you're starting out brings me hope. Like, seeing that people are creating new examples of how they include others, new examples of ways of innovation. I think that is what brings me up, because I can actually see the change that is coming and the tides that are turning.
Wonderful.
I'm also an optimistic person, so yeah, that was kind of my line. I thought I'll say like that. We are in a good space of starting. Yeah, we have a long way to go, for sure. But there is attention, and the fact that this topic itself is part of a colloquium it's something great. So yes, there is a long way to go, but I think diversity is very important, and it will get its due in time.
That's an important question. So what I say is culturally grounded interventions that are coming up, like, for example, antenatal care services for indigenous population, and gender affirmative societies, for example, mental health services for transgenders, and also digital health solutions, so where we can use AI for multilinguistic evidence portals and other things. And the last thing, I think it's also cross-country relations that we are developing, and now Australia and India are together. So similarly, we have a lot of learning from different countries and international network and local network. That is the hope that I'm looking forward to. Thank you.
Thank you. And Promise, what brings you hope?
Thank you, Bianca. What gives me hope is, just thinking about, where we are now and where we were 10 years ago in terms of this idea of EIDM. I must say, I've had sort of a privilege of, working with on a project that involves talking to several different players, particularly in the African context, who are driving EIDM, and just talking about even the trends and the changes that they have seen in terms of the appetite, the understanding, the awareness of evidence-based decision-making. And I can tell you, the appetite has grown, although the patterns are not necessarily uniform across the continent, but there is in a general growth in the appetite for, the use of evidence for so many different reasons, right? Even from the political aspect of it. And just to give you another example, I defer back to Ghana as well, because I found the developments quite interesting. In Ghana, one thing that, obviously it's a democratic country, but from a politics point of view, and this is the language that, the stakeholders that I've talked to have actually used, there's a sense of fear of the citizens by politicians, because they can easily be removed, right? They can easily be punished. And you can look at, the recent elections and what transpired. So politicians are almost like now forced to refer to the evidence to justify the decisions that they're actually making, because if they don't do so, they will easily be removed, right? And, so there is a strong appetite for use of, and they're actually using this evidence, right? They refer to reports for organizations like Afrobarometer, CDB Ghana that I have actually basically mentioned. You have organizations like ASEPA, that are driving, evidence use within Parliament. And ASEPA on its own has catalyzed the establishment of a data management system within the Parliament itself. So we are seeing some patterns where parliamentarians are actually now using the data and evidence during, parliamentary sessions themselves. And like I said, maybe the patterns are not really uniform across the continent, but it's these developments that we see, some pockets of development that we actually see that, for me, actually give me hope. And the hope, again, is that, that appetite, those trends also transition and progress in other countries. So just to highlight some of the elements that, give me hope. But there are so many other, examples. If we're just looking at the trends in the development of the EIDM concept, the Pan-African Collective for Evidence will tell you, the developments that has happened in the landscape in South Africa. You have organizations like ACRES in Uganda, they would also tell you, and recently I've had the opportunity of speaking to the executive director, you know, some of these elements, the policymakers have become actually more aware and sensitive to all these issues around EITM, and there's a progression in terms of establishment of evidence units within different ministries in Uganda, above and beyond just health. So some of these developments, in my sense, actually give me hope that we're headed in the right direction. Thank you and all.
Wonderful. Thank you so much, Promise, for joining us despite all the challenges. We are so appreciative. A big round of applause for our panellists and our plenary speakers. And before we leave, I just want to provide, now Promise, the next time I see you, I will have a gift for you, I promise. But in the meantime, thank you so much, Lynn, for joining us. We are so appreciative. A big thank you again, and now we head into morning tea. We have morning tea on both sides. Please do interact with our exhibitors. They've also got chocolates and sweets and other things to entice you to speak to them, and then we'll reconvene at 11 o'clock for concurrent sessions. Thank you so much, everyone.